Thank you very much, Tasneem, and welcome everybody, and good afternoon from Victoria here in Melbourne. And we are looking forward to 12 o'clock tonight to regain some of the things that we normally are able to do. So I really look forward to the presentation and sharing my extensive experience with you. And of course, doing that about a topic that I'm very passionate about personally and professionally. It's an absolute honor. So if I can, hopefully that will work. So just in a nutshell, on one-page slide about what AMCS is about and our purpose. And everything that we do, we try to do it to improve people's lives through care, support, and empowerment. Colleagues that I have worked with know that we always try to do much more than we are funded for, and be quite innovative in our work. So we've, in 2 years' time, we are celebrating 40 years. Our pure focus is particularly on CALD communities. We are inclusive of all nationalities, and we also work with Indigenous aged care providers right throughout Australia in our great partnership with the Centre for Cultural Diversity and Ageing. We employ 180 staff, have 200 bilingual volunteers who support our work, and in any given week, we support about 1,700 clients. And on the right, it's a reflection of one of our latest initiatives, and that's the anti-ageist images competition that we are running. It's one of the entries, and we're trying to make our contribution to how older persons are portrayed, and are trying to move away from images that are not necessarily positive and optimistic. And so I hope you enjoyed that image. When I think about fair go and generally access and equity, and I was fortunate to understand that concept 30 years ago during my Bachelor of Arts Multicultural Studies. And I also say hello to my colleague Sandra Leone, with whom we actually did the course many, many years ago. So when I think about access and equity, I always think of these sort of 7 principles, sometimes that you can see on the screen. Sometimes there are 5 of them, they are grouped together, but in the end, if every service provider did this, ensured that services are accessible, that they are equitable, that there's right communication that occurs, that services are responsive and effective and efficient and accountable, because most not-for-profits are government funded, those that are funded and approved service providers. In the end, this was already determined in 1989, many, many years ago. And I always refer to it, because in the end, this is the essence, what we're all trying to achieve. If this was done right, there would be no need for ethno-specific specialized agencies and providers. Perhaps there could be an advisory role and support role, but not necessarily providing services. But that is not the case. And I have to say, my conclusion after all those years of being directly involved in working with CALD seniors and with CALD communities, I don't believe this will actually be achieved. So there are 2 views. One view is, and that's the view currently that's communicated by the Royal Commission into Aged Care report, is that every provider is expected to make sure that they respond appropriately to people of various diverse backgrounds and those that have various diversity aspects. I am actually quite disappointed with the recommendations in relation to CALD communities in the Royal Commission report. I was hoping for much more than that, and I will refer to it throughout my presentation. So I hope you find that useful, and it's certainly very applicable to every mainstream organization. And recently I presented to the senior management team at this National Stroke Foundation, and this is what I refer to. This is what we need to aim for. So what is the situation now regarding CALD senior voices? So there's no national, I'm not aware of a national or Victorian CALD older person sort of advocacy body or representative body. If it exists in other states, if you can mention that in the chat, that would be great. It would be great to share that with so many participants of this conference. I do not believe that COTA Australia and National Seniors, who are very important as representative bodies, represent CALD seniors adequately. FECA relies on a number of feedback sort of opportunities through the State Ethnic Communities Council surveys and etc. The Senior Victorians Advisory Group that has been set up by the Commissioner for Senior Victorians here, and Marian Lau, and someone who is well known, and myself are the CALD representatives on that group, but this is not a CALD group as such, so therefore the issues that are discussed are relevant to all the seniors, and that is important, and we are pleased to be part of it and contribute to it. But I do like the idea of an independent voice that focuses particularly on CALD seniors. And we also know that local government have various older persons advisory groups, and that varies from municipality to municipality. So overall, there's really no effective input into government policy advocacy representation that involves older CALD people directly. We know that there are various, of course, ethnic representative bodies. I mentioned a few here, and these organizations often work and have quite significant focus on CALD issues and have actually funding for that purpose. The question is that feedback and the processes involved adequate, and are they really achieving an effective CALD older person's voice? Do we need to do more in terms of consultation and engagement? And I suspect that most of you will agree that that is the case. And often, of course, time and resources is a constraint that affects that. So there are various committees that exist. The ECCV here has a Positive Aging and Aged Persons Policy Advisory Committee. Ethnic organizations and providers often collect information, but that is rarely shared widely. Is there a scope for doing a survey, for example, of 1,000 to 2,000 CALD seniors in Australia to find out what is important to them, their priorities, wishes for the future? So that's really where I'm coming from. Is the CALD older persons sort of state or national representative body that aims to influence the political, economic, and social institutions? So what we do know is that at least 30% of older persons in Australia, from the 4 million that are here, are of CALD backgrounds. Some of the largest communities are, of course, the Italian, Greek, Cantonese, Mandarin, Maltese, and that's an example from Victoria. And that's a direct reflection of the migration waves that occurred here. What we also know is that CALD communities are aging at a faster rate than the general population. That is really important to remember. Hence, it's a very relevant issue, not only because of the current percentage, but the fact that this percentage will actually be increasing. What we also know is that up to, I just thought I'll mention some relevant aspects, and up to 60% of CALD seniors in certain communities do not use the internet. And for example, that's particularly applicable to the Italian and Greek community. We have clients who don't want to have a mobile phone, and we need to respect that. Often when I'm part of various advisory groups, including the Senior Victorians Advisory Group, we have departmental representatives speaking, and they're saying it's all online. Well, clearly what is online is not appropriate for at least 60% of certain CALD communities. We also know with certain communities that they have a quite high usage on the internet, but they use it in their own language, and that applies like to Chinese and Vietnamese seniors. And I've noticed one of the participants is Christine David from IT for Retirees, and it's very, very relevant that we continue to do more to help seniors bridge that divide between online and information, and what they need to be able to manage care and their support system independently as much as possible. So why is it important to consult CALD seniors? And I really liked what Tasneem mentioned before. And for me, this is the essence. We really learn from listening. Those of us, and I do have a senior citizens card, but certainly, I'm not a care recipient as such. And in the end, only until we listen to the voices and the views of people who hope to receive care, are receiving care, can we truly know that we are responding to their needs. And of course, they are individual needs that each of us has and preferences as well. So I cannot emphasize the importance of it, and I have no doubt that to all the colleagues and everyone participating, that awareness, understanding, and acceptance of that is there. It's what can we do to ensure that this is incorporated into the day-to-day practices of relevant organizations and services. So the benefit of that is, of course, that all the persons can share their cultural sort of perspectives, attitudes, and how great it is that we can have a peace of mind that we are doing the right thing, and all of us will want services to be responsive in case we need them in the future as well. So it's part of our good investment as well, but also, of course, doing the right thing. I'll just, so this information, I have some information here which will be available in case people want to look at it later, but those that may want to access this later after the conference finishes. So we know that there's a reluctance to access services. That is quite important, hence the importance of this whole access issue, which is number one. If you have the right access, then you can ensure that the other things hopefully will follow, and that will result in equitable support compared to the general population. We also know that CALD seniors, and not just CALD seniors, but CALD seniors particularly, frequently experience lack of information and find the whole MyHK and access to services quite difficult. The fact that you cannot actually see anyone in person, the only option you have at the moment is to ring. And I think the fact that that will be extended and provide an in-person option will be great. What we also know is that some of them, perceived or real, believe that they cannot afford some of the services, which is rather unfortunate. And what we also know, of course, is that many seniors have experienced disappointments when they try to access the service system and that it does not meet their needs. And lastly, the whole issue of paperwork. Our service agreement for the most comprehensive program is 30 pages. It's not something that I'm comfortable with, yet at the same time, we have legislative requirements which we need to include in the contract. And that's the challenge and struggles that every service provider has, even for an organization of our type, where we really try to walk the talk and be true to what what we're trying to achieve. Some things are really complex and challenging to manage. So clearly the best thing is when information is multifaceted and it's gathered through various options. My background is in social sciences, so I always like the idea of action research, which really means that you are documenting information every day, every hour as you go, and it happens right throughout the organization. The benefit of that, of staff and volunteers and everyone collecting information and listening to the voices of seniors and incorporating that into our activities. All the things that I have here on the screen, that nothing new. Just a word in relation to the multilingual lines. Unfortunately, often their usage is quite low. So although I think the idea is good, but then there's the challenge to what extent they are actually utilized. And here at AMCS, we have moved quite significantly into this co-design approach. We've actually partnered with a co-design company for the last 3 years, I think at least, and now have been able to incorporate it much more and actually run it independently of having a co-design specialist. It is possible to do with some coaching and support. So unfortunately, overall, many initiatives do not collect data regarding CALD. So the Aging Well report that was published and commissioned by the Commissioner for Senior Victorians did not collect information about ethnicity of the 4,300 participants in the survey. So we don't actually know how many CALD seniors participated in that. Hence, I am a very strong advocate for doing our own thing and collecting information. And I am able to say this information because I've actually tried to determine that and find out. So how do we bring change through consumer voice? I think we need to look at this whole issue of advocacy and really establishing processes and committees for that to happen. A draft name that I have is Multicultural Elders Council. There is a similar structure mentioned in the Royal Commission into aged care. I believe that we should try to do our own in addition to that, to whatever government will establish as part of implementation of the recommendations. We need to make sure that we continually empower CALD seniors to be able to be the voice and act and advocate on behalf of themselves with our support. And this whole issue of innovation and using creativity. Lobbying is important. Not-for-profit organizations do need to be careful with because of the charitable status that we have. We can call it communicating or influencing rather than lobbying. But my view is that lobbying as such has actually reduced in the last few years or for many years. And I think there's a need to reinvigorate that nationally to make sure that ethnic seniors do receive a fair go. And the things that they are entitled to and for which they've worked and are equally entitled to be supported. And then, of course, if the participants could submit other options, how we can change that, and anything that's innovative or different would be great to hear of. So I'll share with you sort of our approach to co-design, so how we approach it. So these are the questions that we ask. So how might we change existing services or develop new ones? What do we need to do to continue to support clients to create a better client experience, and also to attract new clients? And when we start a co-design session, normally these are the questions that we ask. What is the desired outcome for clients? And using this whole idea, like understanding a day in the life of a client, that can help to generate ideas. We know that, staff who work directly with clients do know what seniors do. One of the things I'm told, for example, is that seniors often wait for a son or daughter to ring, wait for someone to come to provide care to them, wait for medical appointments, wait for the phone to ring, and their life is often waiting, and for me, that's so important. What can we do to change that so they are not waiting, that they are in fact proactive in managing their lives and making the most of the fact that they are able to enjoy retirement and life after working, which of course so many people don't have that opportunity. And then we have a co-creating solutions with clients, and then we prototype and test solutions. So that's how we normally approach it. We have recently run a few of those sessions for various programs, and we were very pleased with the outcome, what that has generated. Just a slightly different approach, and it's surprising how helpful that can be. So I have gone to the trouble of actually drafting objectives for a Multicultural Elders Council. And again, not for those of you that have worked in the aged care advocacy with CALD seniors, with CALD communities, you won't be surprised by any of this. What we're really talking about is acting and advocating on behalf of the CALD seniors to provide opportunities for them to discuss issues that affect them, to help with policy formulation, to encourage full participation, and anything else that may be relevant to achieve the goal that this body would have. And I'm hoping to be able to establish that. So anyone who is interested, I'm hoping that this will be a national body. If you can let me know, I welcome all queries and offers. And these are our general emails, and then I'm open to questions if this opportunity exists. So over to you, Tasneem.
Thank you. Thank you very much, Elizabeth. That was great. And I mean, once again, this is just a very fascinating example of how you can actually show collaborative programming that is both culturally diverse and consumer-led. And I think that's really where so much of us want to be and where we want things to be headed. So thank you for that. There are actually a few questions that have been raised, Elizabeth, so thank you for agreeing to take those on. The first one is from Ilias Relias, and he has asked, what are the current channels for culturally diverse older people to speak directly to governments and agencies about aged care and other issues?
Mm-hmm. So, of course, the first thing comes to mind is that we all live in an electorate and federal electorate, and we have to remember that aged care is a federal issue now, and the state government used to be much more involved in the old days when CHSP was hack. So I really like the fact that when in Australia, you can knock on the front door of the your federal MP's office, and most of them do have offices in the actual electorate that they represent. Often members of parliament's offices are somewhat like almost welfare bureaus, partly because people go to see their staff there and members of parliament about anything that affects them. So I would actually encourage that, because in the end, that is the direct and very democratic opportunity that we have to communicate the concerns or any issues or any assistance that people need. So I would encourage everyone to actually, seniors or whoever has an issue, to this is an opportunity. You can also write to the Minister Richard Colbeck, Minister for Aged Care, Canberra, Parliament House. It will reach him. That's another one, going straight to the top. I believe that because time is of the essence, and we all have limited time, we should go right to the top, and then this information trickles down. This is what I've been doing. It's not unusual for me to write to the Minister. I do that all the time. I request meetings with them and I take seniors with me. I have done that. It was great when the state government here had community cabinets to actually and I established an older persons lobbying group for seniors to be with me, because in the end, I'm just a facilitator, I'm a supporter. In the end, the seniors, if we support them and help, do some preparation and planning, they can actually do it themselves, and they are absolutely fantastic in doing that. So this is my suggestion.
Thank you.
Mm-hmm.
Look, I do want to, that's a great point. Power to the people. Activate your public right to contact your official and your member of parliament. The next question, we only have a few minutes. I'm going to try and get through them if we can as quickly as possible. But why do you specifically think that culturally diverse older voices are missing from the discussions? Is it the onus on organisations to do better, or do seniors themselves need to skill up?
So I think it's
both.
That's
rhetorical. Why do you think older voices are missing, culturally diverse older voices are missing from the discussion? Is the onus on them to step up, or should organisations be adapting?
Look, it can come from both. I think often it can be a partnership. Look, I do come from a country where, in fact, the workers partnered with the actual academics and changed a regime to a democratic system. I originally come from Poland, and we had 1 million people who belonged to the same trade union. It was extraordinary, and it was a combination of the two that achieved a huge political change without actually much bloodshed. So I come really from that kind of country and perspective. Let's work together. Sometimes natural leaders evolve from communities, and that's fine. But I think as professionals, clearly, most of us are always available to assist whenever needed.
Okay, thank you very much for that. And I think Charmaine has asked about who your co-design partner is and if they can find out more about your projects.
Okay, so Impactor Consulting, it's our local here in our municipality. So it's a great young professionals. They initially offered to actually do a co-design session pro bono for us. We applied. I think they had 3 pro bono opportunities for not-for-profits. We applied, and we have been partners ever since. And we certainly can share information. So if you could just send an email that I've had on the screen there, info@amcservices.org.au. We're happy to respond and share some of the projects that we've run, including in relation to carers, co-design with carers and co-designing with people who are living with dementia and others.
No, thank you for that. And we'll definitely make sure the conference organisers put your contact details in the chat. In fact, if you need to follow up with any of the speakers from today, please approach the conference organisers. Look, the final question, I think, which hopefully we'll have some time for, is from Nora. And she has asked, what has actually changed in terms of practice on the ground as a result of feedback from culturally diverse communities?
Well, that's not an easy answer to question. That's not an easy question to answer.
Have things changed sufficiently, or do you think they're on track to get better, or do you think we've sort of stagnated?
So, from my perspective, the progress has been too slow for me. Too slow, and I am talking about 30 years. Look, it's next month is actually 30 years since I've started working with CULT seniors. So that's a long time. And that partly relates to the fact that from my assessment, particularly Commonwealth government's commitment to CULT in a practical sense has reduced. We have to remember that for many years, we didn't actually have an older person's strategy. At the moment, we have a framework. I think the reporting is limited. So overall, my assessment is that commitment to CULT has reduced and we have allowed that to happen. So that's one. I think there's greater awareness overall about CULT, but we know that organizations can do not a lot and be able to continue to receive funding and not necessarily do it as well as we would hope to do. So we are, so that's where we are. Okay. I would say I would say no. So it's not a fair go yet.
But I think it's an honest prognosis, and I think that's or a diagnosis, I should say. And look, I guess that leads into the last question. I promised the last one. It's from Marcel, who loves your passion on the subject and has shared with us an alarming statistic from the World Health Organization in which 52% of surveyed people were ageist.
Yes.
And does this mean that you will get lip service from 1 out of 2 or half of us when you approach them? And what can be done about this, considering we will all hopefully get old eventually, sooner rather than later?
Look, so that's right. We do have very good information that from the World Health Organization, and I know there's a very comprehensive report which I think involved 87 countries and thousands of participants. We also are fortunate to have the Australian Human Rights Commission who conducted a report into ageist attitudes and perspectives, and that is available. And we have Dr. Kay Patterson, the Age Discrimination Commissioner, who is a very strong champion, as is Jared Mansour, in this whole issue of ageism. And those of you that are interested in this topic, please connect and sign up for the Every Age Counts campaign that was initiated and is championed by the Benevolent Society in Sydney. So AMCS is one of the organizations that has signed up, and so there are things being done.
Perhaps if you could supply those details in the chat as well, that would be great, Elizabeth, because I think that would be something people might be interested in following up with.
Yes. So if we can I please ask that all of us become champions of anti-ageism? And I do look forward to sharing the competition that we are currently running about anti-ageist images. It finishes on Sunday. There's a $1,000 prize, and second prize is $500. And we will continue to run that on an annual basis now. So any of you that are interested in this topic, we need to do more, because for me, the reason why we are where we are, and we had to have a Royal Commission into aged care, because in the end, my view is that we do not respect older persons in Australia adequately. In the end, we don't. there's a culture here, and I'm told that the more affluent society, the worse this sort of anti-ageist views permeates through the society and everything that we do. But there's so much more that we can do, and let's take this on and tackle it, because it's completely inappropriate, and it's so inappropriate to Indigenous elders, to CALD elders, to everybody.
Absolutely. Look, I totally love your passion. Elizabeth, thank you so much for sharing your insights. And everyone, you heard it here first on the Centre for Cultural and Diversity's Aging Conference. It's a call to arms, a revolution against anti-ageism. So sign up and get active and get busy.